Hello everyone, and welcome to my journal club presentation. My name is Kayla Culhane, and I am here to present the article entitled Feature Microbes to Deal with Stress. A psychobiotic diet impacts microbial stability and perceived stress in a healthy population by Berding et al. This article was published in October of 2022, so it is a slightly older article, but it focuses on the interaction between the human intestinal microbiome and the brain, and how we can reduce stress through probiotic use. I'd like to present the bottom line up front, or the bluff of this article first. Specifically, I'd like to address why studying the relationship between gut health and stress is important. Many of you have heard of the gut-brain axis, the bidirectional communication that occurs between the central nervous system, or the CNS, and gut microbiota. This communication is responsible for maintaining homeostasis of the CNS and regulating mood. So, since it has been shown that gut health is responsible for mood regulation, Berding et al. Set out to answer whether a psychobiotic diet would be beneficial in reducing perceived stress. And these researchers found just that. Berding et al. Showed that a psychobiotic diet does reduce perceived stress. There is some background information that is important to understand prior to diving into this study. As mentioned, I will talk about psychobiotics, what they are, and how they work. Then I'll explain stress, how it affects the gut, and the perceived stress scale used in this study. Finally, I will examine the state of gut microbiome science and its relationship with stress. Psychobiotics are defined as a live organism that, when ingested in adequate amounts, produces health benefits in patients suffering from a psychiatric illness. Psychobiotics are simply probiotic bacteria capable of affecting the mood of an individual. The use of psychobiotics to treat stress is a fairly new venture, with the first use of these probiotics described in 2013 by Dinan et al. In this study, researchers discovered that psychobiotic bacteria, especially Bifidobacterium infantis, are capable of producing and delivering neuroactive substances like serotonin and gamma-aminobutyric acid. This research was essential in opening the door to the study of psychobiotics and their effects on the gut-brain axis. Two important factors of this study are stress and the perceived stress scale, or PSS. Stress can be defined as an acute threat to homeostasis. Stress can cause many symptoms, with a major symptom being digestive issues. These issues can present in the form of just about anything, including abdominal pain, diarrhea, and constipation. These symptoms are caused by the release of stress hormones to the GI tract and inflammation altering the gut microbiota. The perceived stress scale is the gold standard measure used in psychology that evaluates the recent stress levels of an individual. It is composed of 10 questions, which are scaled from 0 to 4, with 0 indicating never experiencing, and 4 indicating that the individual very often experienced this feeling. So, why should we study psychobiotics in the first place? There are plenty of ways to reduce stress out there. All you have to do is search stress relief techniques on your favorite search engine, and thousands of results are at your fingertips. Well, for one, not all of these techniques are helpful to everyone or suitable for everyone. Medication doesn't always work and can be difficult to start. There's also a type of depression called treatment-resistant depression, or TDR. TDR can be described as a form of depression where medication does not reduce symptoms. It was estimated that between 10 and 30% of patients with major depressive disorder were resistant to treatment. Mental illness in the United States is also on the rise, with 23% of adults in the United States reporting they had a mental illness in the past year. That's equal to about 60 million people. As someone with anxiety, as well as other mental health disorders, I would say the need for new treatments is becoming imperative. The medications prescribed for mental illnesses usually have severe side effects, like increased feelings of depression, risk of suicide, increased fatigue, and cardiovascular risk. If a psychobiotic diet is able to treat the stress associated with depression and other mental illnesses, this diet may be useful in treating disorders like TDR, or even in preventing onset of disease in the first place. Feed Your Microbes to Deal with Stress was a single-blind, randomized, controlled study which took place in the Cork area of Ireland in 2022. The participants consisted of both male and female participants between the ages of 18 and 59 who were considered healthy but had poor dietary habits. The phrase poor dietary habits was expanded upon and refers to diet containing sweets, fast foods, or sugary drinks. On this slide, you can see the basic layout of the author's methodology, beginning with the dietary intervention, which lasted 4 weeks. Biological samples and questionnaire collection took place prior to and after 4 weeks of dietary intervention. Cytokine levels were quantified from blood samples. Fecal microbiota were quantified via shotgun sequencing with Illumina Next sequencing. And fecal metabolomic analysis was performed for short-chain fatty acids, semipolar metabolites, and lipids. Meanwhile, blood, urine, and saliva were all analyzed. Finally, statistical analyses were performed, including bioinformatic analysis of fecal samples and the microbiome, metabolomic analysis, and the calculation of a dietary adherence score. After determining the sample size to be 30 individuals per group needed to achieve significance in the changes of microbiota, this study started recruitment. This study began recruitment at the beginning of the COVID-19 pandemic, however, so the recruitment process was cut short, with only 45 total participants in this study. After establishing which participants would be in each diet group, an individual informational session was given by a registered dietitian to each patient. In the first psychobiotic diet information session, the participants' diet from the past week was assessed. After assessment of diet, individuals were instructed on the study's diet. As shown on the slide, the psychobiotic diet consists of high prebiotic, fiber, and fermented foods. For women, the calorie allotment was between 2,000 and 2,400 kilocalories daily, with men needing to consume between 2,400 and 28 kilocalories daily. After 2 weeks, a refresher session for the psychobiotic diet was held, and diet was assessed again. For those in the control diet, educational sessions held during the same time interval consisted of minimal input on dietary intake. Individuals in the control group were instead pointed towards the Health Service Executive Ireland food pyramid, as shown on this slide. Sample collection involved 2 major components: questionnaires and biological samples. A 7-day food record and frequency questionnaire were used to quantify dietary intake. 2 self-report questionnaires were given to assess both perceived stress and general health. The Cohen's Perceived Stress Scale was completed prior to and after the dietary intervention. Gastrointestinal health was scored on a GI Symptom Visual Analog Scale. A physical health exam was performed and sleep quality was measured using the Pittsburgh Sleep Quality Index, or the PSQI. Stool, blood, saliva, and urine samples were all taken from participants to build different profiles, including a blood inflammatory profile, metabolomic analyses, and measuring the cortisol awakening response. Each of these analyses will be explained in further slides. Blood inflammatory profiles are used to quantify biomarkers for inflammation. Many times, inflammation is the result of a stress response. In this case, researchers used the VPLEX pro-inflammatory panel 1 kit, and quantification of cytokines was performed according to the manufacturer's guidelines, all except the use of a 100 microliter sample that was left undiluted and put onto the plate. DNA extraction from stool samples was performed as follows. 200 milligrams of sample was extracted using the QIMAMP Fast DNA stool mini kit in combination with repeated bead beading steps. DNA quantifications were made using Qubit high sensitivity kit, and amplicon size was measured by Agilent Bioanalyzer 2100. Then, extracted DNA was stored at -20 degrees Celsius until ready for metagenomic analysis. To prepare samples for Illumina sequencing, researchers first pooled 1 millimolar samples of libraries. These libraries were then loaded on the Illumina Next sequence platform for 150 base pair paired end sequencing. Illumina was likely used here to analyze DNA sequence due to its reliability being over 90% for short read lengths. Metabolomics is the study of metabolites in a biological sample. Fecal metabolomics included the study of short-chain fatty acids, lipids, and the non-targeted study of semipolar metabolites. Blood and urine metabolomics were targeted at key metabolites from the gut and gut microbiota co-metabolism of the essential amino acids tryptophan, tyrosine, phenylalanine, as well as branched chain amino acids. Another interesting aspect study was the cortisol awakening response. The cortisol awakening response is a natural stress response upon waking and can be varied when an individual is suffering from chronic stress. Cortisol awakening response, or CAR, was measured from 4 different saliva samples taken within the first hour of the participant waking. According to the article, statistical analysis of all data was performed using SPSS 25 via the per protocol analysis. Outliers were identified and were then removed based on how extreme they were. Normality of data was based on the Shapiro-Wilk test, and if necessary, data was transformed to fit normality. Different transformations were performed, including natural log and square root transformations, to achieve normality for several different variables. Some variables, including the Pittsburgh Sleep Quality Index measures and GI health, were unable to be normalized and were not normal to begin with. An unpaired t-test was performed by researchers to compare the pre- and post-intervention differences between groups. So, I guess it's time to get to the results. Let's get right into it. In the first figure presented by Berding et al., it was shown that perceived stress score was reduced when participants adopted the psychobiotic diet for the 4-week intervention. A 32% decrease in perceived stress was seen in the diet group, while only a 17% decrease was seen in controls. This decrease in perceived stress in the control group may be due to adoption of a healthier diet after participation in the educational session in the first day of the trial. In Figure 1b, the correlation between perceived stress and adherence score was shown. The controlled group is not shown here as they did not have to adhere to a diet. A more negative change in perceived stress is associated with a higher diet adherence score. This means increased adherence to diet led to more changes in perceived stress. The range of dietary adherence scores began at 41%, or a score of 25 out of 60, and achieved up to 100% adherence, or a score of 60 out of 60. Average adherence was a score of 65%, or a score of 40 out of 60. The most difficult aspect of the diet to adhere to was eating fermented foods, with participants eating only an average of 1.7 servings per day of the recommended 2 to 3 servings. In these violin plots, the orange violins indicate the control group, and blue indicate the diet intervention group. V2 refers to the pre-intervention measure, and V3 refers to post-intervention. Neither alpha nor beta diversity was significantly impacted by a psychobiotic diet. However, there were statistically significant increases and decreases in certain bacteria species. Blautia wechsleri, a commensal present in the gut microbiome, was the only bacterium that increased due to psychobiotic diet. Decreases in several bacteria species occurred with Coprococcus comes, Dorea longicotina, Blautia ovium, Eubacterium rectale, Gemmiger firmicillus, and Bifidobacterium longum, all showing significant decreases when compared to pre-intervention stool samples. Depletion of many of the bacteria that showed a decrease here are usually associated with increased risk of health issues, such as irritable bowel disease and obesity. However, many of the decreases were only slight, but are still considered significant. Microbial function was also studied within stool samples. To study this, the gut-brain modules, GBMs, and gut metabolic modules, GMMs, were used. No difference was seen in the GBM, but the GMM showed some changes, shown here. A subtle normalization and slight upregulation of the glyoxylate pass can be seen in the diet group after intervention. You can also see a slight upregulation of xylose degradation, a decrease in lactate production, and threonine degradation is also shown in the diet group. These results show that the probiotic bacteria within fermented foods had an effect on the gut microbiome's function in the diet group. A change in composition of the microbiota, or volatility, is very important when deciding if a probiotic treatment is safe in humans and therefore worth exploring further. This figure compares perceived stress score changes to volatility of the microbes. After psychobiotic intervention, it was shown in this figure that microbial volatility and perceived stress scores changes are positively correlated. Therefore, a higher change in perceived stress score was associated with a lower change in the composition of the microbiome. This is exciting news, as a major change did not occur in the microbiome composition, indicating that the psychobiotic diet was effective in reducing stress while maintaining microbial volatility. At first glance at the volcano plots on this slide, you can clearly see there is a significant change in the fecal lipids shown in A, the diet intervention, when compared to B, the control diet. The 40 red dots indicate statistically significant altered genes in the dietary intervention group that were not altered in the control group. Earlier, I mentioned that short-chain fatty acids and semi-polar metabolites were studied, but they were not affected by diet. Here you can see the 13 urinary metabolites that were significantly changed by diet intervention. As before, the orange indicates the control group and blue indicates the diet intervention group. As you can see, the essential amino acids tryptophan, phenylalanine, and leucine all decreased due to dietary intervention. Usually, this indicates some sort of malabsorption or nutrient deficiency leading to depletion of serotonin. This is odd, as the dietary group was shown a decrease in perceived stress, which would make you think an increase in serotonin. Another decreased metabolite included quinolinic acid. Increased concentrations of phenylpropionyl glycine were also seen in the dietary intervention group. The final figure, figure 4C, depicts the two significantly changed plasma metabolites in dietary intervention. Of the 34 quantified plasma metabolites, only hydroxyquinurinin and hydroxyindole 3-acetic acid showed significant changes, both decreasing in concentration after dietary intervention. A decrease in hydroxyquinurinin is associated with vitamin B6 deficiency. A decrease in hydroxyindole 3-acetic acid as a serotonin metabolite is associated with a decrease in serotonin production. Another decrease in serotonin production seems odd to me. To represent the bottom line up front, I'd like to start by saying that a psychobiotic diet, or a diet high in prebiotic fibers and probiotics, can be beneficial in reducing perceived stress. After a 4-week dietary intervention of the study's psychobiotic diet, it was shown that perceived stress in the diet group decreased significantly, at an average of 32%. Along with the decrease in stress, this group showed a change in 40 different fecal metabolites, 13 blood metabolites, and 2 urine metabolites. Decreased change in microbiome composition, as well as greater adherence to diet, were also associated with lower perceived stress score. Berding et al. Showed that a psychobiotic diet can be beneficial to reduce stress without disrupting the gut microbiome. All of these factors point to a psychobiotic diet being valuable to reducing stress. In a world where antidepressant medications are prescribed to around 13% of Americans, and an increased risk of cardiovascular disease due to antidepressant use exists, having a secondary option for individuals that would rather avoid health concerns associated with medications is important. A psychobiotic diet, specifically increasing the consumption of prebiotic fibers and fermented foods, was shown in this study to decrease stress over a 4-week period. I had a few questions after reading this paper that may be interesting to explore. If you have comments, questions, or answers to these questions, please comment on perusal. I would love to see what your thoughts are on psychobiotics. First, I'd like to ask how the perceived stress scale relates to disease diagnosis in clinics. I'm more familiar with the DSM-5 for diagnosis of mental health disorders, so if anyone else is more familiar with the perceived stress score and how it relates to mental health disorder diagnosis, I would find that very helpful. Next, I'd like to ask how antibiotics would affect perceived stress score. We all know the physical side effects of antibiotics, but what about the mental side effects? Do you think antibiotics will show the exact opposite results as seen in this study? A question pertaining to the psychobiotic diet I came away with is, can the diet be sustained for long enough to treat or even cure mental health disorders? Berding et al. Showed that a short 4-week intervention reduced perceived stress dramatically. So do you think a more extended intervention may treat the underlying issues of the stress? Another question I had was whether stress affects other microbiomes the way it affects the gut. As mentioned, metabolites from stool, blood, and urine samples were all altered by the psychobiotic diet. This makes me wonder how bacteria present in these locations and other body spaces react to stress. My final question has to do with the safety of the psychobiotic diet. With many metabolite concentrations, especially lipids, being decreased due to dietary intervention, I immediately thought of how safe this diet is. Safety is probably the most important factor of medicine next to efficacy, so it's important to consider if this diet is going to do more harm than good. Thank you everyone for watching my presentation. I hope this information is useful in your own life, as I know many of us live with great amounts of stress. If you have any questions or comments about this presentation or article, I hope to be able to answer your questions as soon as possible. Good luck with the rest of your semester, everyone, and thank you. And then here are my references. Thank you again.